Hi everyone, in this video we are going to compare two different diseases, Duchenne muscular dystrophy and cerebral palsy. We will tell you what each disease is, how it comes about, and how it affects an individual's life. In addition, we will be comparing them, contrasting them, and talking about how people with both of these diseases have accessibility crises in the world. First, we ask the question, what is cerebral palsy? Cerebral palsy is a disorder that can originate before and after birth. This disease is termed to encompass a number of disorders that affect muscle tone, movement, ambulation, posture, and development, as shown by these illustrations. The source of the disorder stems from abnormal brain development at very early stages of life. This can also lead to the loss of the control of muscles in one's body. Now let's talk about the symptoms of those that have cerebral palsy. Every person with this disease may experience it differently. Some people may experience intellectual disabilities, blindness, deafness, epilepsy, and poor ambulation. Symptoms of this disease last a lifetime, as there is no found cure for CP as of today. Those with severe CP may not be able to walk without the use of medical equipment. Others with milder symptoms may just experience imbalance or poor motor skills. It's not every person with cerebral palsy that eventually becomes non-ambulant, but it's those that have the most damage to the brain. Now let's talk about the different forms of CP that exist. There are three types of classified CP. Spastic CP is the most common, and its symptoms are described as muscle stiffness resulting from increased muscle tone. Ataxic CP is classified by poor balance. People with this type of CP have a hard time maintaining control of their movements and proper coordination. People with dyskinetic CP lose control over their upper and lower extremities. You may ask the question of what exactly causes cerebral palsy, and that can be defined by abnormal growth and development of the brain. This disorder can occur at three vital stages of life. It can occur before birth in the womb, when a genetic mutation could lead to abnormal brain development or a fetal stroke that seizes blood supply to the developing brain, and the mother who is pregnant can also have an infection that can lead to this disease in the fetus. During birth, there could be bleeding in the brain or lack of oxygen caused by the birthing process. Also, in early stages of infancy, physical trauma like falls or accidents can cause this disorder. What are some problems that people with cerebral palsy may encounter? They may have problems climbing up the stairs, as it can be hard on their muscles. Typing on the computer can also be difficult for their fingers. They have a hard time walking through clusters of people, as they may not be able to ambulate as quickly and efficiently as others. They may have a hard time paying attention, whether that's in class or with conversations with other people, as some people do have intellectual disabilities. Talking may also be a problem, such as swallowing, as it is a reflex and they may lose control of that. Writing can also be very hard for a child and also a grown-up with CP, as they have very poor motor skills.
Talking about cerebral palsy, we also got introduced to DMD, or Duchenne muscular dystrophy. Now, what is that exactly? In this deep dive, we will learn about the cause and effects, how one acquires DMD, and how it progresses throughout their lives, what they require on a day-to-day basis, and how it affects an individual's life journey. In this case, we'll go through an individual's personal experience and see how he went through his life with Duchenne muscular dystrophy and all the hardships that he overcame.
So let's get started. Before jumping into his journey, let's talk about what Duchenne muscular dystrophy is and how it affects an individual. As you see, it is a disease that affects the muscles of our limbs, mostly our arms, shoulders, skeletal, cardiac, and other types of muscles. Over time, these muscles degenerate and as a result, cause a lot of issues with mobility and the structure of our muscles. Some typical symptoms that we see with Duchenne muscular dystrophy patients are seen in this image, with a weak knee, with weak arms, a lean back, and other symptoms that make it harder for individuals to do day-to-day tasks, like walking. And is there only one type of dystrophy? The answer is no. DMD falls under the umbrella of muscular dystrophies, yet it is the most common form and affects the lower limbs first, as we see here, where it's highlighted on the shoulder and hip regions. As we see from these images, most of the patients are boys. And why is that? It's because Duchenne muscular dystrophy is an X-linked recessive inheritance disease, where the affected X chromosome gets transferred to the boy patients as they only carry one X. Being such a slow and progressive disease can take a toll on the day-to-day life. From the little boy that we were introduced in the beginning, his life would mostly consist of doing exercises, meeting with the doctors on a weekly to monthly basis to check how his muscles are progressing. Physical therapy and light aerobic exercises would help ensure that his muscles are not under extreme force. That's something like running, jogging might put a lot of pressure. He'll also start using accessibility devices like wheelchair.
Let's now look at the commonalities between cerebral palsy and Duchenne muscular dystrophy. We know that DMD is a dystrophin deficiency disorder that is seen in boys. Interestingly, cerebral palsy is also more commonly seen in boys than in girls. Both disorders have the function of affecting muscle tone and strength. In addition, they both can lead to poor and no ambulation. Diagnosis happens at a very early stage in life for both diseases as well. Here in this video, we can see that on the left is a picture of a boy with DMD and on the right is a picture of a boy with CP, and they are both wheelchair bound.
Now that we've discussed some of the similarities and differences between DMD and CP, we're going to talk about the accessibility of both. Obviously, a lot of the things that we are going to mention will depend on the stage of one's disease, but in general, there are a few things that may or may not be accessible to people with mobility disorders. Here, we define accessibility as the quality of being able to do or acquire something, whether that be walking, eating, showering, anything among those sorts. So what are some things that people with both DMD and CP can do? Well, depending on their stage of DMD, many people will still have function in their fingertips for a while before reaching a very late ambulatory phase. Therefore, arts and crafts is a great option. Things like painting or coloring can be done for a very long time. Same for people with CP. In fact, this can help with fine motor skills, and overall, it'll be a very good outlet for children dealing with their disease to express their feelings in a creative fashion. Another fun thing could be board games. They are mentally stimulating, and a lot of the times you can have someone else help you roll a dice or move a piece. As long as you can verbally let the other players know of your decision, it can be a fun way to hang out with friends or family. Finally, swimming is another great option. Aerobic exercise is encouraged for people with DMD and CP. It is something that will not be too strenuous on the muscles for people with DMD, and it will allow for extra mobility for people with CP. Overall, it'll be an easier movement that both people can enjoy. Moving on to travel and parks. Disneyland has a few wheelchair accessible rides, and they have on-site electric wheelchairs for use. While many rides will not be accessible for people with DMD, such as Splash Mountain, rides like It's a Small World will be a fun and easy trip for anyone. People with CP will most likely be able to ride every ride at the park due to their easygoing mechanisms for the rides and, of course, depending on the severity of the CP. In terms of travel, a lot of buses have ramps that are accessible for wheelchairs and people in general who are unable to climb steps. If there's a ramp leading down to the subway, they can have access to underground transportation. Planes and cars are also known for having spots for wheelchairs or seats with extra room for those who need it. There are also little day-to-day things that we probably don't even think about that offer accessibility for people with mobility issues. Curb cuts are common for crosswalks, and they have a dip allowing people in wheelchairs to be able to cross, and people who may have a hard time walking to avoid a whole nother step. The extra side of the table that may seem longer than usual is another accessible resource. The ramps we may see around campus or in a hospital may seem minuscule to some, but means accessibility into common places for others. Parking spaces being closer to the entrance is a common thing as well. Having hallways clear of hazards or barriers are commonly talked about when it comes to fire safety, but having it clear for people with mobility issues who may not be able to go around certain things is another helpful aspect. Unfortunately, as their disease progresses, there will be less things they are able to physically do. Things such as regular sports or weightlifting are things that people with DMD are highly advised not to do. Eventually, they will not even be able to functionally do these tasks regardless. And even though Disneyland is accessible to many people, places like Six Flags, where it is roller coaster heavy, a patient with DMD would not be able to even place themselves in a roller coaster past the age of probably around 12. It would not be recommended any time before then either. On the other hand, depending on the severity of cerebral palsy, it is actually quite safe to ride roller coasters or play sports. This is where we begin to see some differences between the two diseases. As long as your neck and head is strong enough to carry itself, you will most likely be admitted on safely. There are certain occupations that people with CP could potentially acquire, such as teacher or someone who can work from home. Something that involves less mobility would be optimal. People with DMD, on the other hand, would have an immensely hard time working in almost any occupation because their non-ambulatory stage comes so soon in their usually short-lived life. Eventually, people with DMD will no longer be able to feed themselves, clothe themselves, or even breathe for themselves. Here is where we see a significant difference between CP and DMD. So our main takeaways are CP and DMD have similarities and differences that we have pointed out in our video. In almost all cases, it is safe to say that the severity of DMD surpasses that of CP, but they are still both diseases that hinder mobility, thus making it costly. It is not only costly financially, but time-wise, and also mentally and emotionally on everyone involved. Luckily, we do have things that try to accommodate the needs of people who struggle with these kinds of diseases, such as ramps and accessible parking and other things mentioned previously. We still have a long way to go in terms of making the world accessible to as many people as possible, but every effort counts. Science and society work hand in hand to make improvements for living. Little by little, we hope to see a change for the better in how we treat and consider those who need a little extra support. Thank you so much.